So today we're planning septo rhinoplasty for this handsome guy from Chennai. So what is his main concern? His main problem is he's not able to breathe well. Since many years he has one nostril totally blocked. He's met some surgeons and they've told him that he needs a procedure for the septum. But also what he's noticed during those years is the fact that his nose has gotten bent and it's moved towards one side. And in his case, you can see very clearly it's moved to the left side. So this is what we're saying. The nasal pyramid is like this now. So this nasal pyramid, if you see, this is the starting point, radix. It's in this direction. This angle has to be made like that. So this nasal bone is in a much more sharper angle than this. So all of this has to be corrected. The other thing, if you see, is the tip, which is actually in the midline of his face. So if you look at it like this, you can see that the nose is going towards the left, but the tip is going towards the right. And then when you look from down, you can see the asymmetry or extra flare, and the shape of the nares, everything is not exactly symmetrical. Now, why has this thing happened? This is mainly because of a septal issue, but as he's grown, it's pulled the nasal bones and the associated soft tissues along with that, leaving him with a deviated nose and a blocked nose. Planning a septo rhinoplasty for him. He's even got his IV line. So what's the approach? It's going to be an open approach for him. I'm going to be first going down, looking at the septum. The entire 5 centimeters of the septum is totally deviated. So we're going to be doing a lot of septoplasty, septal harvest, come out, then fix the septal extension, and then go on to the radix, osteotomy, if need, rib harvest. So it's probably going to take me 2 hours, a little bit more or less. So what are the issues with this kind of procedures? Well, the first main thing is because there's a lot of septal work, we're going to block his nose and keep for a few days. So that will be a little bit of a problem for you, okay, because you'll breathe through your mouth. That's the main concern because we're working a lot on the septum and also we're working on the nose. The next thing is, I've already mentioned to you, because it's a lot of bony work, you might want to give yourself a couple of extra weeks of healing apart from the 4 weeks that I usually say, right? That's the second thing. And then of course, the whole thing will be really nice. We'll have it on the straight of your face. So we're not going to do much with the shape change of your nose because once it's on the midline, your nose will look nice. It'll suit your face. We really don't have to do much about the shape change and everything. Maybe I make it a little bit narrow, but not much. All, pretty much the same nose, but in the right place. Okay? Thank you. Collapsed. There's a totally deviated nose, so we've corrected that. These are the puncture injuries for the osteotomy, and then the nasal base work, good tip support, good bone. So the front is really there. We have nothing to do, just antibiotics and all that. We'll take the pack on 4th day only.
4th day? It's 3rd day, I guess.
Yeah. Nala. Tomorrow evening?
Ticket நாங்க இப்போ புக் பண்ணிக்கலாமா?
மதுரை சென்னை போறீங்களா?
எப்பத்துக்கு
Tuesday. நம்ம டியூஸ்டே சர்ஜரி பண்ணுவோம் உங்களுக்கு இல்லை வெனஸ்டே பண்ணுமா? டியூஸ்டே பண்ணுவோம். அப்போது வெனஸ்டே எடுங்க. போகலாம். இல்லை ஸ்டே பண்ணணும்னா ஸ்டே பண்ணலாம், ஆப்ஷன் இருக்குது உங்களுக்கு. பட் ஃபைனலாக 8th எனக்கு கண்டிப்பாக பார்க்கணும். ஆனால் ஃபீவர் இருக்கா இல்லை, அது பிகாஸ் நேசல் பிளாக் கன்ஜெஷன். செட்ரிசின் we can add for him maybe vivo செட்ரிசின். அப்போ அது நீங்கள் ஒன்று நைட் மட்டும் போட்டுடுங்க. நேசல் பிளாக் இருக்குனால அப்படி இருக்கும். நாளைக்கு இது எடுத்த பிறகு கொஞ்சம் ஃப்ரீ ஆயிரும். இந்த பிளாக் உள்ளாலுடைய அது ஒன்றும் இல்லை, லைட்டாக வந்தால் நோ ப்ராப்ளம். நல்லா வந்திருக்கு. ஆமாம், இப்போ பார்க்குறது இல்லை, நம்ம சர்ஜரியே பண்ணியிருக்கோம்ல. நல்லா வந்திருக்கு. ஷேப் இம்ப்ரூவ்மெண்ட் வந்திருக்கு, நேரோ ஆயிருக்கு, பெண்ட் ஸ்ட்ரெயிட் பண்ணிருக்கு, எல்லாம் பண்ணிட்டோம். டோன்ட் வரி. ரைட், பண்ணிடலாம்.
Hello to all our viewers. We are here at Richardson Hospital. Another patient, rhinoplasty. Almost more than a week over, right, for you? Yeah, more than a week over for him. He happens to be from a neighboring state. It's time for us to remove the splint for him. I will go on to explain as to what expectations he had come with. He had very specific objective desires when he had come and very genuine concerns. The scan also showed the same. I'll proceed with the splint removal and go on to show his pre-operative pictures such that you can understand what his pre-operative condition was and what he is desired. Just a sticker. Keep your head straight. One minute. Clean up a little bit and close your eyes. So I'll go on to explain as to how he had come, what were his complaints. We'll have a look at the pre-operative photo. Little bit of cleaning needs to be done, you can surely see yourself. Okay, have a look. So when he had come to us, his complaint was very objective. He had a nose which was sharply bent. It was bent towards his left, right?
My septum was deviated.
Your septum was deviated.
I had
Yes,
severe breathing issues.
the scan had clearly shown that the septum was deviated and he had breathing issues. So for him it was a case of septorhinoplasty. So this was how his dorsum was. There was a straight bend towards the left. Right now also he had a complaint of a hump, of a bony projection on the right side of his nose. That has also been corrected. We'll see the basal view once. Look a little up. Yeah. So this view gives us a clear picture of how sharply bent his nose was. So we have corrected the shape of the nose. The tip has been shifted to the midline. The dorsal aesthetic lines have been kept intact. The projection has been taken care of. We have also worked on the alar rim. The flare has been decreased. We'll see a comparison on all the views now. Look straight. You can have a look at the frontal view. Yeah, the tip, the entire bend has been corrected. How is your breathing now, Ananda? Okay, I know certain patients complain. Yes, certain patients complain that there's a lot of plugging that they feel. That's because of the work which has been done. There could be blood, there could be mucus, but I'm sure post the pack removal, your breathing has been better than before.
Yes.
Yeah, it's very kind of him to say that it will take time. At least he understands on that, but it will surely take time. The stitches will clean them up. The stitches will be removed because it's over a week for him. You can also have a look at the side view. You can hold the mirror and see yourself. Can you see the pre and the post-op picture now? So we have created these dorsal aesthetic lines, a smooth transition from the radius to the tip, right? Yeah, you can also have a look at the frontal view. There's still swelling. Entire swelling will take time to come down, almost a month's time. Okay? And hopefully by the end of it, your breathing will also improve markedly. We can also highlight upon his scan, upon the CBCT scan, which clearly shows how severe his DNS was, which is the deviated nasal septum. Externally also, the rhinoplasty has corrected the cosmetic appearance, but functionality was the main concern for him, and that is the reason he underwent this procedure. So it was a case of septorhinoplasty for him, and we'll go on to remove the stitches and give him further instructions of following it up. Thank you.